Okay, now we're going to talk about these great boxes that we're able to provide our patients that have a lot of resources for them when they suffer a loss. And again, this is from MOHA, Mother of Held Angels provided these boxes for us. There's two sizes. There's the small box that is intended for patients that are less than 20 weeks gestation, and a larger box that's intended for patients that are greater than 20 weeks gestation. If you have a baby that is greater than 20 weeks gestation that's on the small side, please feel free to use the small box, your discretion. The first item that you're going to see is this great wood plaque. This is for their footprints or their handprints, and they do provide also a great ink pad for us to use with that. You can also decorate these if you want with the beads, with anything that you have, feel free to decorate that. The next items are comfort care items for the patient. There's some really nice non-slip socks, nice, warm, and fuzzy. Also in the large box, there's a nice gel mask for the patient. And then there is lavender scent if we need a more fresh scent in the room. This is great. Also lavender helps us with sleep, so a nice aromatherapy for the patient. In the large box, there is a very large blanket, nice warm fuzzy blanket to provide comfort for the patient and her family, also with the MOHA logo. In the smaller box, it is a much smaller blanket that's intended to be used for the baby. You can put this in the crib, you can put the baby on top of the blanket as well. There's also a container. This has Kleenex in it. Once the Kleenex is used, this is a nice little container for the patient to have her memories in there as well. Next, there's some books. The first is just a journal. Always talk to the patient maybe about journaling. It can help her through the grief process. And then also patients have found when they look back at what they wrote during the time of delivery and the time immediately following that, it has provided comfort to them. So a great book to journal. And then there's 3 different books. You Are Not Alone, also Empty Arms. And then there's a book specifically for the dad called From Father to Father. MOHA is working to get us these books in Spanish, especially the first 2 that I talked about. And once that's available, then we will put those in the boxes or have those available for you to pick English or Spanish. There's also the MOHA brochure. Take time to look through this. It's a great resource. This is available in English and Spanish. So we will have these on the cart and available to NICU and mother baby in English and Spanish. Also for the baby, there is a separate tape measure. So for the larger babies, you can mark the length on the baby and maybe put the date and time of the birth. This is a great memento for the patients to have. And then the last thing I want to talk about is this wonderful bear. This is a scented lavender. It smells like lavender bear. It has a little bit of sand in it, so it provides comfort to the patient. What MOHA recommends is that when we take the baby to the morgue and the mom has decided that she's had enough time with her baby, and at the time of discharge, that if we place this baby at the fundus of the mom and we tell her to hold on to it, that can provide comfort to the patient. This can be warmed by the patient when they go home. Let's refrain from using the microwave at the hospital to warm these, just because it would pose a fire risk. But again, it smells great without even being warmed. We are super, super thankful to MOHA for providing these great resources to our patients. They will continue to provide them after the first initial supply is used. And so we do have a process to make sure that they get replenished so that all of our patients have these wonderful resources and ability to create memories of their time here at the hospital.